Russ Curtis, professor of counseling. Thanks for joining me today. Thanks for all the open-minded people out there following the channel. I wanted to talk about antisocial personality disorder versus psychopathy. Now, there's a lot of overlap between these. The DSM does not contain psychopathy as a diagnosis. However, they do include antisocial personality disorder. And so we need to know what this is when we see it and know the differences. So I wanted to just kind of highlight a few things here. And I'm using the 5-factor model. So the 5-factor model test, you can find online versions, of course. And this is based on the lexical hypothesis. They analyzed all of the language in our dictionary related to behavior traits and to personality traits. They grouped those and they came up with kind of 5 domains. Some people have added 6, such as humility, but the 5 are neuroticism, extroversion, openness to experience, agreeableness, and conscientiousness. Let's just look at this for ASPD and psychopathy. All right. With neuroticism, this is important for folks high in psychopathy. It would be low. They are emotionally detached, fearless. They are resistant to stress. So they actually report low levels of depression, low levels of anxiety, low levels of self-consciousness. With extroversion, that's mixed on the antisocial, but it's high on psychopathy. They are socially bold and charming. And what this can look like is they love to be in a situation where their bold-faced line, I think it's bald-faced line, because they're not going to show signs. And they know that most people are looking for those signs. They're blushing or sweating or shaking or whatever. They're not going to have those. And that thrills them that they can bald-faced lie and nobody can tell the signs of that. Openness to experience, we're seeing moderate to low for antisocial. We're seeing moderately high for psychopathy, meaning that they're risk-taking, they're creative in the ways they manipulate others, and they enjoy novelty, meaning they're not going to want to work in the same place for very long, although they could. But they're going to want, and they're not going to want to be in the same relationships, maybe even in the same town. So agreeableness, very low for antisocial. We're seeing hostile, dishonest, exploitive, but extremely low for psychopathy because there's a profound lack of empathy. And I do think neurobiologically, we're seeing that their amygdala is just not activated the way somebody else might be. And with antisocial personality, I think there's literature suggesting that abusive households, extreme abuse can lead to this. Psychopathy is often considered a little bit more innate, not saying that stuff that happens very early in life couldn't create this, but it's also possible that people are born with these traits, and one of the parents may have one of these traits. Okay, lastly, conscientiousness. We're seeing with antisocial, low, so it's impulsive, irresponsible, struggles with planning. However, with psychopathy, it's mixed. And one thing I wanted to point out as underlined is a high ability for strategic planning. So with the antisocial, they want what they want when they want it, and they don't think about the long term. Okay, anyway, so then psychopathy, however, they think about the long term. They think about how they can manipulate folks to get what they want, money, sex, material goods, what have you. And they're very kind of creative and even patient with how they do that. I don't think patience would be a trait that we would talk about with antisocial. All right, again, this is not to necessarily label or vilify. These folks need treatment if they want treatment. But however, as people out in the world and mental health professionals, we need to know the difference and we need to be able to see it and be able to provide good treatment when we do see it and recognize it. Let me know your thoughts on this. We'll talk to you in the next video. Take good care.